Hi, my name is Casey Kessner. I will be doing your intake assessment today. I will just be asking you a few questions, and I just need you to give me the most truthful answer that you can.
Okay.
What is your first name and how do you spell it?
First name is Rue, R-U-E.
And what is your last name?
Bennett, Bennett.
What is your date of birth?
September 14th, 2001.
And what is your preferred name?
Rue, R-U-E.
Okay, do you have an emergency contact?
Yes.
What is their name?
Leslie, Leslie.
Okay, last name?
Bennett, Bennett.
And what is the relationship to you?
My mother.
And what is your contact address?
571 653 2323.
Your um your address.
38 Chris Lane.
And
in
state and zip code and
uh,
city.
West West Virginia 26508.
And what city is that?
Lincoln.
And what is your contact's phone number?
571 268 2323.
Okay, I am now going to ask you some personal information. Uh,
Okay.
What was your sex assigned at birth?
Female.
What is your gender identity?
Gender queer.
What is your preferred pronoun?
She, her.
Okay. What is the reason for your referral?
Was referred for substance use following a relapse after previous rehab program for an ongoing opioid use and coping for anxiety and depression and unresolved trauma.
Okay. I am now going to ask you about your alcohol and drug history.
Okay.
Um, for alcohol, what was the age of your first use?
15.
Okay, and what is your current substance use with alcohol? Are you, do you not
Um,
drink? Do you currently use, currently abuse?
Current dependence.
What about amphetamines?
Yes.
What was your age at first use?
15.
And what is your current status with those?
Current use.
And cocaine?
15 as well.
And your current status?
Current use.
Opiates?
14.
And
Current use.
hallucinogens?
Don't use.
What about sleeping pills, painkillers, Valium, or anything similar to that?
Don't use.
PSP or designer drugs,
Don't use.
inhalants,
Don't use.
marijuana,
Uh, at the age of 14 for first use, and currently I use.
tobacco or nicotine,
No,
caffeine, such as energy
no,
drinks, sodas, coffee,
no.
any over the counter,
No, not prescribed.
or any other substance,
No,
any complementary alternative medication.
no.
What is your previous recovery treatment?
I did inpatient rehab.
Okay, where did you previously go? What was the name of the facility?
Lincoln Heart Center.
And what was the dates of the previous treatment?
August 1st, 2024.
And was your treatment completed?
Yes.
Is there any other facilities that you had went to? All right. So we're going to go over your medical history now. Um,
Okay.
what is the name of your primary physician?
Connor Yang.
And what is their phone number?
904-897-6655.
And when did you last see him?
December of 2025.
Do you have any other medical providers?
No.
Um, did you have any weight changes?
Yes.
Okay. And what did that look like?
My starting weight was about 125 pounds. And then during my usage, I was around 110 pounds, as well as throughout recovery.
Do you have any chest pain, hypertension, hypotension, palpitation, or smoking?
Um, I do smoke and I occasionally have chest pain.
Um, for the genital urinary or bladder, is it in, I can't say that word. Noctura, urinary tract infection, retention, urgency.
Some retention.
Do you have any heartburn, ulcers, diarrhea, laxative use, constipation, incontinence, nausea, or vomiting?
Nausea and vomiting, yes.
Do you have any headaches, dizziness, seizures, memory, or concentration?
Yes, I do get headaches and dizziness. I do have memory issues and it's hard for me to concentrate.
Do you have any back pain, stiffness, arthritis, or mobility or ambulation?
No.
Are you pregnant, have pelvic inflamed disease, TBI, LOC, or menopause?
No.
Do you have any scars, lesions, lice, dermatitis, or cancer?
Scars, yes.
Do you have any diabetes, thyroid issues? Do you have any bronchitis, asthma, COPD?
Asthma.
Have you had any significant accident injuries or surgeries?
I was hospitalized following my opioid overdose.
Do you have any physical disabilities?
No.
Do you have any chronic illnesses?
No.
HIV disease or liver disease?
No.
Have you tried any alternative healing practices?
Supplements, yes.
Okay, and did you get those from a provider or over the counter?
Over the counter.
Okay, and um, do you know the dates in which you tried supplement?
Um, about a month following my when I got released from rehab, so probably January.
Okay. Um, did you have a reason for trying supplements?
Um, was still trying to face the opioid relapse.
And was it helpful? Was it not helpful?
Not helpful, no.
Are you prescribed any psychotropic medications or non-psychotropic?
Um, no, not at the moment.
Did you have any psychiatric ho- sorry, hospitalizations?
No, not outside of rehab.
And you did have outpatient treatment?
Yes.
Um, do you have any risk factors such as aggressiveness, violent behaviors, or self-harm
Yes.
for both of them or just one?
Yes. For both.
Do you have any mental health disorders?
Yes. Anxiety and depression.
Um, did you have any family problems that could be contributing to or is the reason why you
Um,
lent
I
on
just
something?
recently lost my dad.
Um, were your parents separated or were they still married?
They were married.
And there was no domestic violence in the household?
No.
Um, would you say that you have any social problems that are contributing to your substance use?
Um, no, I'm just very introverted.
Do you think that you have any economic problems that are contributing to your substance use or because of your substance use?
Um, no.
What are some cultural factors that you think influence your use of substances or that have made the
Um,
start using substances?
I am African American, so I feel like there's a little bit of a stigma around that in my opioid use, um, as well as being queer.
What is your education like? Are you in high school or in college? What
I'm
is
in high school.
Do you have any problems in school?
Um, I don't tend to do really good in school. I skip a lot and don't really do a lot of my work.
Is there a certain class that you skip or you just skip the whole day?
I just skip the whole day.
And what grade are you in?
I'm a sophomore.
So since you are a sophomore in high school, you are not currently employed.
No,
Okay, we are now going to talk about your criminal history or legal statuses. Um, just like before, we answer as truthfully as possible. So that way we can get you the best help that we can. Have you had assault on a person within the last 90 days?
no,
Or what about the past?
no,
Have you made threats to a person in the past 90 days?
yes,
And in the past as well?
yes,
Have you ever caused property damage
yes,
within the last 90 days and the past?
yes,
Have you ever had any weapons involved
no,
in any legal history?
no.
Okay. So have you been on probation within the last 90 days?
Um, no, but I was not on like legal probation, but on like self probation from um, my AA sponsor
Okay. Is that within the last 90 days or was that within
within the last 90 days.
and within the past? No.
No,
Have you been on parole?
no,
Have you been adjudicated?
no.
Sorry, I'm not good at pronouncing words. Um, what about diversion?
No.
Can you describe some of the criminal justice involvement and incidents to me in just a few little sentences?
Um, I've never been like incarcerated for anything, but like I've run from the cops and in the midst of running from the cops caused property damage.
And you mentioned you made threats to a person. What was that incident like?
It was mainly to my mom, just in a yelling conversation of threatening to leave her house and not come back and threatening to kill myself.
Um, have you had any relevant family involvement with criminal justice?
No.
Are you currently in a relationship?
Yes.
And how long have you been in that relationship?
Um, on and off for about a year.
Do you have any history of sexual abuse?
Yes.
Do you have any history of physical abuse?
Yes.
Do you have any children?
No.
Okay. Um, I'm gonna now ask you about your symptoms and like what substance you used, um, and when you used it.
Okay.
Um, so the substance is often taken in larger amounts or over a longer period than was intended. What substance was that for you?
Opioids and alcohol.
Okay. When did you first experience this symptom? Or like how
Within
after using the substance did you start feeling that symptom?
within the past year.
Persistent desire or unsuccessful efforts to cut down and control the use of the substance.
For opioids, also within the past year.
Okay. You spend a great deal of time um, in activities necessary to obtain the substance.
Yes, for opioids within the past year.
Do you have a craving or a strong desire or urge to use the substance?
Yes, ongoing for opioids.
Okay. And how long have you, the past year as well?
Yes.
Um, Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home.
For alcohol and opioids and at school.
Um, what substance do you continue to use despite having persistent or reoccurrent social or interpersonal problems caused by the effects of the substance?
For opioids, hinders my relationships.
And about how long when the symptom was experienced?
Um, Ongoing.
Have you given up anything because of the substance? And what
Uh,
substance was it?
when I was using opioids, I gave up my school and my social life.
Um, do you recurrent substance use in the situations in which it is physically hazardous?
When I use alcohol, yeah, probably within the past year or so.
Sorry, I don't even know what just happened. Um, you continue to use this substance by the knowledge of having persistent or reoccurring or physical or psychological problems.
Yes, for opioids, it's ongoing.
Okay, so your tolerance, it has it um increased with the amounts of the substance achieved for your intoxication or desired effect, or has it diminished?
It's increased.
And what um are you using?
Opioids.
What about alcohol? Has it stayed the same or diminished or
For alcohol, I'd say it's diminished a little bit.
um have you been in withdrawal from
Yes, from opioids.
okay. And when did you experience this symptom?
It's continued. It's been ongoing.
Would you say that you have mild substance use disorder, which is 2 to 3 symptoms, moderate, which is 4 to 5 symptoms, or severe, which is 6 or more symptoms?
Probably severe.
Um, would you say that you're in early remission, with no symptoms, except for cravings? or 3 to under 12 months, or more than 12 months.
Um, I'd say probably early remission. Hi, my name is Alia Hindi, and I'm going to be doing your intake assessment today. I'd like you to be as honest and truthful with me as possible and answer these questions to the best of your ability.
Okay.
What is your first name?
Nathan,
Can you spell that for me?
Nathan,
And your last name?
Scott, Scott,
Okay, and your date of birth?
April 30th, 2002.
Okay, and what is your preferred name?
Nathan or Nate.
Okay, and what is your admission date?
Um, March 11th, 2026.
You said what year?
2026.
Okay, and who would you like as your emergency contact?
Haley James, HaleyJames,
And what's your relationship?
girlfriend.
Okay, and what is her contact address?
12 Brick Lane, um, Romney, West Virginia, 26757.
Okay, and her phone number?
304-871-2345.
Okay, and what is your sex?
Male.
Okay, and how do you identify?
Male.
And your preferred pronouns?
He, him.
Okay, and what is your reason for this referral?
Um, when I was in high school, I had used drugs to enhance my performance in basketball. Um, and during one of the games, I had passed out and was in the hospital. Um, and then when I was in college, I had gotten into a bar fight and was pushed through a window, which broke my back. And I was depressed about not being able to play basketball anymore. Um, so I started to lean towards alcohol to solve my problems.
Okay, so when you got into this bar fight, you said you went through a window, and did you break anything?
It broke my back, my spine.
Okay, And who is your primary assigned counselor?
Um,
Do you have a school counselor or anything?
in college, I had a counselor, but I don't have one in the moment.
Okay. Do you know what their name is?
I can't remember off of the top of my head.
Okay. Okay, we're now going to go through your alcohol and drug history. Have you ever used alcohol?
Yes,
And at what age did you first use alcohol?
17.
And what is your current substance use with alcohol?
Um, in recovery.
Okay. Um, have you ever used amphetamines?
Yes.
At what age did you first use? 16. And what is your current substance use?
I don't.
Okay. And have you ever used cocaine crack? And have you ever used opioids? Hallucinogens? Sleeping pills, painkillers, Valium, or similar medications? PSP?
No,
Any inhalants?
no,
Marijuana?
no.
Tobacco or nicotine? Caffeine?
Yes.
At what age?
Um,
What was it?
18.
Okay. And what's your current substance use with caffeine?
Um,
Can you say that again?
independent.
Okay. Um, have you used any over the counter medications?
Just like the average. Okay.
Okay. Any other substances or alternative medications? Okay. Okay, we're now going to go through your alcohol and drug treatment history. Um, have you had any type of previous recovery treatment, whether it was outpatient, residential, or detoxification?
I've not had any treatment besides at the hospital uh,
Okay.
but I just had that.
Sorry, I can't hear you. It's like really choppy.
Can you hear me now?
Yeah, that's better. Okay, so you said just um, in the hospital after your accident?
Yes. I did not get put into recovery treatment or a facility because my father wanted to keep my drug use very quiet.
Okay. And do you remember the name of the hospital?
Um, it was Tree Hill Hospital.
And what was the date of that treatment?
Um, it was November of 2020.
Okay. And okay. For your medical history, do you have a primary physician?
Yes.
And what is their name?
Chad
What was the last name?
Frankie.
And their phone number?
304-813-0123.
And what was your last appointment there?
Um, January of 2026.
Okay. Do you have any other medical providers?
No.
Okay. Um, what is your current weight? Baseline weight?
Um, I think like 195.
And have you had any significant weight changes? And if so, what were those changes?
No, I don't.
Okay. Have you ever had any chest pain, hypertension, hypotension, palpitation, or smoking?
Um, a little bit of chest pain when I was using the drugs in high school.
Okay. And for your urinary tract, have you ever had any incontinence, nocturia, urinary tract infection, retention, or urgency?
No.
Okay. Have you ever experienced heartburn, diarrhea, constipation, nausea, or vomiting? Any ulcers, laxative use, or incontinence?
No.
Do you get headaches, have dizziness, seizures, memory, concentration issues?
Headaches.
Okay. Do you have any back pain, stiffness, arthritis, mobility, or ambulation?
I have back pain and stiffness, and I was in a wheelchair um for about 4 months due to my back injury, but I am no longer in a wheelchair.
Okay. Are you pregnant? Have any pelvic inflammation, TBI, menopause?
No.
Do you have any scars, lesions, lice, dermatitis, or cancer?
Scars.
And what are the scars?
Um, it's just like the typical growing up scars from like falling off a bike and stuff like that.
Do you have diabetes, thyroid issues?
No,
Do you have bronchitis, asthma, or COPD?
no.
Okay. Um, do you have any significant accident, injuries, or surgeries?
I had a surgery on my back, um, being pushed out the window in a bar fight.
Okay. And was that the only time you've had a hospitalization as well?
Um, that and after passing out during my basketball game.
Okay. Do you have any physical disabilities,
No,
chronic illnesses,
no.
HIV, or liver disease? Okay. Did you partake in any alternative healing practices like acupuncture, hypnosis, herbs, or supplements?
I did have physical therapy for my back after my
And was that after your surgery?
Yes.
And what date was that?
Um, December of 2020.
2025. And was it helpful?
Yes.
Okay. Are you on any current medications that are psychotropic? Are you on any non psychotropic medications?
No.
Okay. Do you have any allergies, reactions, or sensitivities to anything?
It's unknown.
Okay. What was the date of your last physical?
Um, October of 2025.
And the date of your last dental exam?
April of 2025.
And were you referred by your primary care?
Yes.
Okay. Do you have any additional important medical information that I should know about?
No.
Have you had any psychiatric hospitalizations?
No.
Any outpatient treatment?
No.
Any aggressive or violent behavior?
I wouldn't say violent, but I do cause tend to cause arguments whenever I am drinking um with anybody.
Okay. Have you ever self harmed? Okay. Do you have any family problems that contribute to your substance abuse?
When I was in high school, my dad um was emotional and mentally abusing towards both me and my mother. Um, my mother also um is a user. Um,
And you said your mom was also physically abusive?
no, it was just my dad was emotional and mentally abusive towards both my mother and I.
Okay. And your mom?
Um, my mom was mostly absent. Like she lived at home and stuff, but didn't have very much to do or to say about how I lived my life. She was more worried about um the drugs that she was using and getting back at my father for the things that he has done. And my mother was put in a recovery facility, uh, but she did not do the full recovery.
Okay. And was her recovery for like AA, NA?
NA.
Okay. And do you have any social problems that contribute to your substance use?
Um, I would say so. I'm very extroverted and uh, I have a lot of friends and stuff like that. It was just in high school, I was trying to be the person that my father wanted me to be, or I should say the basketball player that my father wanted me to be. It was a high standard for the player that he wanted me to be.
And would you say that your social problems are mild, moderate, severe,
Um, I would
or no?
I would say mild just because of how my father is.
Okay. Do you have any economic problems that contribute to your substance use?
Um, no, not really.
Okay. Any cultural factors that may influence some problems that you're having?
Um, I would just my living environment growing up in high school, um, like I said, wasn't great because my dad was an emotional and mental abuser. And my mom didn't really say anything about how I lived my life or anything like she cared about her drug use more.
Okay. And what is your sexual orientation?
Straight, heterosexual.
Okay. And do you have any education issues?
No.
And what is your highest level of education that you've completed?
Some college.
And you finished high school?
Yes.
Okay. And are you currently employed?
No. I volunteer with my brother coaching high school basketball. My brother is the coach, but I volunteer to help him with his students.
You said for high school basketball?
Yeah.
Okay. And has your substance use caused any absences, tardiness, accidents, etc.?
No.
You have no work problems at all?
No.
Okay. Have you ever lost a job or consumed any substances while at work?
No.
Okay. Um, we're going to talk a little bit about criminal and your legal history now. Have you ever assaulted a person?
Um, yes.
Was that within the last 90 days or in the past?
In the past.
Have you ever made a threat to a person
Yes.
in the last 90 days or in the past?
In the past.
Have you had property damage done
Yes.
in the past or within the last 90 days?
Within the last 90 days.
Have you ever involved any weapons?
No.
Do you have any legal history?
No.
Have you ever been on probation?
No,
Have you ever been on parole?
no,
Have you ever been adjudicated?
no.
Have you ever had a diversion? And can you describe the assault, threat, and property damage involvement or accidents that you encountered and the outcomes of the situations?
Yeah, property damage was the bar fight that I had gotten into with the window. Um, the assault and threats to the person were to a
You said assaults and the threat.
yes,
Okay.
to the same person over um hitting my wife with their vehicle.
And when did this happen?
Um, it was at the end of my senior year. Assault and threat to a person, but the property damage was my senior year of college.
You said the bar fight was your senior year of college. Okay. And do you have any relevant family involvement with criminal justice,
Uh,
whether it's threats, safety, and the outcomes?
my father had shot and killed his my uncle's
You said he shot and killed who?
brother.
So your uncle. When did this happen?
Um, my junior year of high school. But I didn't find out that he had shot him until my after senior year of high school. No one knew that he had shot him. Um, then he turned himself in.
Your dad turned himself in. What was the outcome of that, of him turning himself in?
He spent about 4 years in jail, because he got out on good behavior, else he would have spent longer.
Are you currently in a relationship?
Yes, I am married.
How long have you been married?
For years,
6 years.
years.
Do you have any history of sexual abuse?
No,
Do you have history of physical abuse?
no,
Do you have any children?
yes,
How many?
one.
And what's the age of that child?
He's 4 years old.
Do you need cooperative childcare?
No,
Do you need access to dental services,
no,
social services,
no,
community services,
no,
educational trainings?
no,
Do you need transportation to and from medically necessary treatment?
no,
Do you need transported?
no.
And what is your knowledge of parenting skills?
Um, I don't want to be like my parents. Um, I try to provide what is best for my child, um, with his education. He's currently in preschool. Um, we did have me for a short period of time, but
You said what?
we did have a nanny for a short period of time when I was in recovery for my back and while my wife was at work,
Mhm.
but we have no longer needed her.
How long did you say you had that nanny for?
Um, Probably about 2 months.
Okay. And what skills do you think are most needed to be an applicable parent?
Um, Need to communicate better with not only my wife but my child, for his needs, um, and as well as what he needs from me as a parent, and be a little bit more involved in his activities that he does.
Okay. We're going to talk a little bit about your substance use symptoms. Um, Sorry, my laptop just blacked out. Have you ever taken larger amounts than intended?
Um, yes, for alcohol.
And when was this experienced?
Um, I drank a little bit too much the night of the bar fight.
You said whiskey?
Um, no, it happened when the night of the bar fight. The
Oh, okay.
Sorry, I'm trying out.
Your audio is getting really choppy again. I don't know why.
Is it better now?
Yeah, yeah.
I
I
think
don't know.
I'm turning it back on.
Have you had a desire to cut down the use of your substance?
Yes. Um,
Was that for alcohol?
yes. I had stopped my drug use after passing out and being in the hospital when I was in high school.
Okay. And have you spent a lot of time in activities necessary to obtain the substances?
No.
Do you have cravings or a strong desire or urge to use the substance?
Yes, for alcohol and months during my recovery.
Oh, you said a couple months during your recovery.
Um, Recovery from my back.
Okay. And does your recurrent substance use result in failure to fulfill your work obligations at school or at home?
For alcohol, yes. And at home, um, I was out of work because of my back injury, and I depended on alcohol, um, while I was at home, so I wasn't the best husband or father to my son.
Continued substance use despite having persistent or recurrent interpersonal problems caused by exacerbated effects of the substance.
I would say yes during my recovery from my back surgery, but not any longer.
And was that for alcohol? Do you have any important social, occupational, or recreational activities that you had to give up or reduce because of the substance?
No, not because of the substance.
Okay. Do you have any recurrent substance use in situations in which it's physically hazardous?
No,
Um, is your substance use in continued despite knowledge of having persistent physical or psychological problems?
no.
And has your tolerance increased or diminished or
Um,
stayed the same?
with alcohol, I would say that it has stayed the same.
Okay. Have you experienced any withdrawal from your substance?
No, not really.
Have you taken the substance to relieve or avoid withdrawal symptoms?
No.
Okay. Would you say that you have a mild substance use disorder, which is about 2 to 3 symptoms, moderate 4 to 5 symptoms, or severe 6 or more symptoms
I would say mild.
for
Um,
your for alcohol?
yes.
Okay, what makes you think that?
Just whenever I would drink, I would argue with people once I got to the like feel good state and like the drunken state.
Okay. And would you say that you think you're in early remission, no symptoms except for craving for 3 to under 12 months, sustained remission, no symptoms except for craving for more than 12 months, or maintenance therapy?
I would say early remission.
Okay, for alcohol.
Yes.
And what makes you think this?
I haven't drank in a few months.
Okay, well, that's all of the questions that I have for you. Thank you for all of your honest and truthful answers.